imagine that. That's the rather sorry state of water and sanitation in some of our healthcare facilities here in Ghana. Let's learn a little bit more about it. The Coalition of NGOs in Water and Sanitation has done some work. Let's learn a bit about it from our two guests in the studio. Now, from Water Aid Ghana, let's say good morning to George Kobina York. He is Head of Policy Advocacy and Campaigns. Hello, Mr. York.
Hello.
And we also have with us Patrick Apoya. He's a member of CONIWAS, and of course he's a water sanitation and hygiene expert. It's good to meet you both. Thank you for making the time. Now, this is truly troubling. That there are hospitals here in Ghana, or healthcare facilities here in Ghana, that have no water source. Tell us about those first. That's like the worst situation. Tell us about those, and then we'll talk about the rest afterwards. Mr. Apoya?
Okay. Sometimes when you begin to talk these things, people think you're overstretching, and that people have lived with the situation for a long time and they're used to it. But some of the stories and things we have seen with the eyes that are very troubling. Imagine a woman, don't look at the urban area. Just go to a rural area where there's no pipe connection. Nobody is drilling a borehole for them. A woman is going to deliver, and the woman is expected to carry her own water on the head to go, and after delivery, that's what they will use to wash whatever she has to wash. Or when you deliver, they pack all your bloody clothing and everything for you. You carry back home to go and wash. Now, it is only not the inhuman aspect of it, but it is also directly related to some of the reasons why we are stagnating when it comes to maternal mortality. Ghana has stagnated for a long time. We are making so much progress in reducing infant and child mortality. In fact, we have halved infant mortality by between 1988 and now. For maternal mortality, the reduction is just insignificant. And it was in the healthcare sector, it was one of the MDGs.
Yes.
That was not met in the health sector. Up to 310 women out of 100,000 women who go to deliver do not come home. And infection accounts for up to 15% of this group. And infection is related to how clean your operation or your delivery would have been undertaken.
So clearly we're seeing the effects of this lack of water sources.
Yes.
Now, for you, George, at Water Aid, it might not be a surprise to people that there are some communities that can't access water. But the fact that a healthcare facility under the management of government would be placed in such a community, and that facility also cannot access, I mean, it beggars belief how healthcare can be delivered without water. But for that to be happening, I mean, how widespread is it, first of all? How many parts of the country will we find this sort of problem?
Yeah, thank you very much. I just want to really touch on some of the global commitment. As a country, we've really ratified a lot of global commitment. We've signed to the SDG, and especially SDG 6, that is really looking at access to water, sanitation, hygiene for everyone, everywhere by 2030. We've also even signed to the WHO commitment resolution of really ensuring universal wash coverage by the same period. And Ghana has also ratified that particular resolution. But the situation is so pathetic. The recent GMP report that came out just in the last month indicated that we have about 35% of healthcare facilities in the least developing countries, including Ghana, without water in healthcare facilities. And for me, that shouldn't be the case.
It's alarming.
Yeah.
But beyond that, we have another problem, which is the quality of water in the facilities that can access it.
Yeah.
Now, I'm hearing that actually one of the most important things is checking the quality of the water is something that almost never happens. What, they're just grateful to be getting water, so they don't really bother checking the quality of it? But what are the implications of not checking the quality of the water used in healthcare?
Yeah, when we look at water, we did a research in Upper East, in 2 districts. And in terms of water access, it was a bit higher because development partners like Water Aid and UNICEF are all providing water facilities in that region. So it was over 90%. But in terms of water quality, when we checked on water quality, we realized that less than 35% really have done water quality in the past year. And that is supposed to be done at least every 6 months. So the people are drinking water, they don't know the quality. And that is also an area where fluoride is endemic. So we have a situation where people are drinking fluoride water they don't know. So they think they are getting water, but in actual sense, they are drinking to their grave, which is so sad. So the water quality issues are really serious issue as a country. People drink from rainwater harvest, but they haven't done any water quality test. So what's the guarantee that the water that they are drinking is wholesome? For me, that is one particular thing that we have to also look at it as a country.
Let's talk about toilets and you know, toilet facilities. Again, there are some facilities that some healthcare facilities that don't have it. Beggars belief once more. But over there, it would seem that the problem is, well, it's twofold. It's first of all perhaps a lack of access to water, which might lead to that. But there are also facilities where they have access to water, but their toilet facilities have been left in a state of disrepair. That is just shameful.
Exactly.
Yeah, tell us a bit about that.
I think I like that part. If you are looking, for me, if you're looking at what is the best situation and the worst situation, I would say the worst situation is the one whose toilet has been left at a state of disrepair. In actual fact, the study that CONIWAS was involved in, that was supported by UNICEF, Water Aid, actually found out that more than half of health facilities in a certain district, which I will not mention here.
Oh, why?
The facilities...
We want to know.
Over half of... Okay, Kwanda district.
Right, good, because they are Ghanaians
half of the facilities were described as death traps outside the district capital. If you go to the district capital, the facilities, they said, excellent, excellent, excellent. You move out of the district capital, everything else was in a state of disrepair. They were described as death traps. Now, the implications of that, if you look at it, is so... Imagine a health worker who agrees to accept posting to such a rural area. Most doctors will not. They will say, I can't work here. They sacrifice their children's education. They sacrifice the comfort of living with their husbands and everything. They get there, and maybe people who have never traveled to that side of the country and who don't know what open defecation is, they get there for the first 3 days, they can't even go to toilet. Because when they enter and what they see, they can't even manage. So they cope with it. After 3 days, they try to fall back to open defecation. I prefer to do it in the open rather than going into such a toilet. If you look at the one which is related to water, 90% of it will be related to that, because in those places, you can't even think of a flush toilet. So they're all VIPs. And VIP, the maintenance is also an issue. It's not like you just shit and go away. There's a way you have to maintain the toilet. And because the toilets are not provided according to the number or the need, there's overcrowding. And when you have overcrowding, the VIP concept will not work optimally. So the feces just accumulate. Instead of actually getting composted and reducing odor, it rots. Instead of decomposing, it rots and it smells, it stinks. So these are the challenges. And it was also because there were no guidelines in the past. Fortunately, UNICEF and other development partners have facilitated that process. And we are hoping that this thing we are seeing, the death trap that you just showed, people now will be able to put their minds on it. The Ghana Health Service, the Minister of Health, Minister of Sanitation and Water Resources, and the NGOs and development partners, with Minister of Finance backing. Unless you pull all these people together to appreciate what our health workers are going through, the problem is not going to be solved.
Right. Now, has there been any work, George, to help us understand what the cost will be of bringing all of these facilities to a humanly usable standard?
Yeah, thank you very much. I think when you look at that, when we even invest $1 in wash, or let's take 1 cedi in wash, we are likely to really gain 4 cedis more. So that has been the trend. So because we are not improving our wash facilities in healthcare facility, we are really incurring more cost in terms of the drugs, in terms of employing more nurses, doctors, and all those things to provide that facility, to provide that service to the people in the area. But I just want to also touch on the issue of infection prevention control. Apoya really indicated that there are guidelines But the interesting thing is that the guideline, normally UNICEF and other development will support in developing the guideline. And they will train some core people, maybe at the regional level, and that is the end of it. In actual sense, the actual people who really need the training are the people who are in the district and in the community. They are not trained. So until other development partners come in to really provide that support to train the nurses on how to even to clean their environment and also really bring these volunteers on board, it's always a bigger issue. So there's a need for us to really not just have the policy developed and train core staff, but how do we ensure that we cascade it to the people who need that service, to ensure that they use it and practice it. Most of the facilities are being managed by volunteers. The cleaning is being done by volunteers. Even in Accra here, you can go to a facility. Most of the facilities in Accra here, you have to pay to use a service. Yeah. In Accra here, I went to Children's Hospital, you have to pay to use a service, to use the toilet, because the issue is that they don't have cleaners. Government is not employing cleaners. So the cleaner that is volunteer that is there should be paid. And as a result, you have to pay for that service to help them really pay for that particular volunteer. Which shouldn't be the
dereliction of duty on the part of government. I mean, yes, we have conflicting priorities. Yeah. But I mean, our health, I mean, is there something more important than that, really? What is WaterAid's assessment of the prioritization government of Ghana gives to WASH, particularly in healthcare?
Yeah, for WaterAid, we think there still needs to be more to be done, because WASH is integrated into other interventions. We talk of WASH in school, we talk of WASH in healthcare facility, we talk of WASH in community. So whatever intervention that you are doing, you have to really look at the component of WASH. And there's that need for government to play that coordination role to ensure that all the players within the sector, their interventions are well coordinated by the Ministry of Sanitation, Water Resources. Because local government ministry is doing aspect, Ghana Health Service is also doing aspect. But if it's not well coordinated, it's scattered all over, and it's really not helping us as a country. But there's also a need for us to ensure that when we develop policies, we develop guidelines, we have to implement them. Ghana Health Service, a Ministry of Health is being supported by UNICEF to develop a guideline to really ensure that all healthcare facilities that we have really have water, sanitation, hygiene as a component. But what happens after they develop that guideline? Will they just sit in Accra here? Or who is going to ensure that that guideline is being financed to ensure that we provide adequate or at least basic wash in healthcare facilities, so we don't have to really build a hospital or a CHIPS compound without wash. And who is even checking to ensure that that is not supposed to be done? That is also the role of the civil society. We need to also to monitor to ensure that whatever intervention that the government is providing, especially the hospitals and the clinics, really have components of wash. If that is not done, then we have to hold the government accountable.
Is there a quick fix, Patrick? Is there something, some low-hanging fruit that government could do that would make a massive impact on this sorry situation?
Yes, there are some low-hanging fruits. The first step is to have all health facilities who cannot be connected to a pipe network. Give them a very simple mechanized borehole. We call it limited mechanization. We're not even talking about piping to the entire whatever. Limited mechanized boreholes that at least you can have water pumped from the underground to your storage tank. That can serve the three categories of people we are talking about in the health facilities. That is the patients who are on admission, people who just come to health facilities to visit OPD and they go home, and then the people who are visiting or caring for the workers. In addition to that, the staff. So even if you can target the staff and the inpatient and the outpatients to start with, those ones are within the health facilities itself. But you also need to also think about the people who are caring for them. They can't use the same toilets as the patients. And those ones that are located outside can all be served by the mechanized systems. Let me also be honest to say that the commitment of government, I would say, is mixed. In some way, they demonstrate that they are very committed. Of course, the president has done it beyond what any president can do. That I can say. But when it comes to implementation, finance minister is the opposite. They don't even see that it's a priority. And nobody's even thinking about wash and health facilities. So if you cannot speak for yourself, then you are finished. Nobody will think of you. That's how we have, that's the kind of financing for development we have in Ghana. It's only those who can speak who get it. The Minister of Special Initiatives, special initiatives, actually had a big program since last year. They awarded over 200 of such health facilities with mechanized boreholes and very beautiful things. We are still tracking, but what is likely to, I don't want to preempt, but it has become political contractors who have no accountability to whatever monies they are getting and who are not actually, I won't preempt the report, but it is not going to be good. So that is the kind of mixed situation that we have. Good at the policy level, but when it comes to actually rolling out, we are seeing a different picture.
That appears to be our problem in almost every sector of our existence. Yeah. So let's look to the future. I mean, this report, it's probably going to highlight the problem even more. You know, you talk about how there is some commitment, but implementation is not. So let me ask this, you know, from the position of water aid, if this is all we can reasonably expect from government, how do we make up the shortfall? Where will the rest come from? Who will come to our aid?
I really think that the whole process should be led by the government. For me, that is key. And we should also look for internal resources. Normally, most of the donor interventions are on pilot basis, and they die with the pilot. So if we, like Water Aid, we have done a lot of work in upper, now we are in Upper East, to Bongo Kasana and Kana district. We've really, we are using a technology that is environmentally appropriate, because one of the challenges is also paying of the water bills. Yeah. There are situations where there's water, but the health facility has no money to pay for the water bill, and as a result of that, they are not getting water for the facility. So what we are doing now is that we are introducing a solar mechanized limited water systems where they don't really have to rely on electricity.
Right.
So those are the technologies that we have to really look at as a country, because we keep on doing the same thing, but they are not getting any results. So there's a need for us to bring innovation in whatever we are doing. Organizations like Water Aid and others are really bringing innovation. But how are we scaling up those innovations? For me, it's a critical thing, because we document, we share, but that is the end of it, because it's also getting money from donor. So if we are working in, we have over 200 districts. So if we are just working in 2 districts and making impact, what about other districts? The Kasana and Kana Bongo recorded 0 maternal death because of the improvement in their water, sanitation, hygiene in healthcare facilities. But what about the other areas? So if we are able to do that, also involve the local people, involve the district assembly to make commitment. For me, that is very, very important. So when they are preparing their budget for the year, they have to really make that commitment to ensure that at least, what do they need? Basic things that they need in the healthcare facility. They should be able to really provide that facility support to the chief's compound, the hospital and clinics in their area, so that we can address the wash needs in healthcare facilities by 2030.
George Kobna York, thank you so much for your time. George, of course, the head of policy, advocacy and campaigns at Water Aid Ghana, and joining us from CONIWAS, Patrick Apoya, who is a wash expert. You really paint a picture there, and it's not a pretty one. I think it's a call to arms. We all need to do something about this. Healthcare is a priority. Thank you.
Thank you very much for also having us this morning.
Wow. Well, there's more to come on the AM show. Stay where you are. We're back after these.